Hello, welcome once again to the Mind series. I'm Dr. Ryan Thompson, Director of Mind Matters Clinic, and with me for this episode is Asha Brock, licensed marriage and family therapist. She's one of our clinicians at Mind Matters. And with this episode, we're going to be addressing challenging kids, challenging families. And so we're going to be talking about what the impact is of kids with ADHD, autism spectrum disorders, and learning disabilities on families, which would include the parents, the siblings, and the whole family as a unit. So oftentimes what we focus on when we treat individuals, we usually treat the disability or we treat the problem and don't always recognize or address some of the impact it has on the family. So tonight I'd like to focus on that. So one of the things I think that we all experience as parents is that we get pregnant, we look forward to the birth of our child, and I think we all fully expect to have a normal child. Mm-hmm. And when that doesn't happen, then I think it shakes everything up a bit, because I think when you're planning on being a parent, that's not really part of the plan, nor could it be. You could never plan on having a child with special needs. So in your experience, what kind of things do parents experience when they realize that their child does have special needs? How does that affect them?
Well, like you said, it starts the second you find out you're pregnant. The dream of your child, what they're going to look like, what they're going to be like, who might they be as an adult, and to receive a diagnosis of autism or disability, it shatters that dream in that moment, and it's really a loss. It's a loss of the expectations and the dreams that you had for your child. So it can be a very upsetting, confusing, and scary time for parents.
I think just in parenting kids too, when you first start out as a parent and you have your tools, which are always inadequate because you're a normal parent, and then you have a child who comes along and is made of a different piece of clay. So a child with ADHD who has behaviors which are not typical, or a child with autism who has behaviors that aren't typical. I think we're all programmed to parent based on the way we're a parent, or the way we have an image as a parent, what should work. And then it can be very, very frustrating for parents when you don't have a child with typical needs, because suddenly the tools you have don't work. So I call it reaching into your toolbox and running out of tools, so that you very quickly learn that what you have doesn't work, and that creates a lot of frustration. What kind of things do you see parents experiencing when they hit that place of frustration?
Well, like you said, they become, they feel helpless. They feel helpless and they feel discouraged. And hopefully, when they're at that point, we see a lot of these parents. So those are the parents that have reached out for help, and they're looking for somebody to give them some assistance and give them some new tools. And like you mentioned, we as parents oftentimes parent the way we were parented, or we use typical parenting strategies that work for most kids. And so learning new tools is really important, learning strategies that work specifically for these disabilities is really, really important.
Now, I know that whenever I work with parents and we do make the diagnosis of ADHD or on autism spectrum disorder or some other related disorder, that oftentimes when we deliver the news, you said they've come looking for help. They're in a place of, they don't come when things are good. They come when things are bad. So they come looking for help, and though it can be validating to find out there is something that's different about your child that's made parenting difficult, or that your intuition or your suspicions that something was going on, it isn't always something that they're going to receive well. I mean, parents, when they hear that their child has ADHD or they have autism, they oftentimes respond not necessarily in a positive way. I know that sometimes they go through different experiences, and I know you must see that in parents. What kind of different ways might a parent respond when you deliver the news that your child has autism or ADHD or something like that?
Well, I see this often when parents come in with a diagnosis of ADHD. Because I think that one's a little bit, it's not as black and white.
Sure.
And I often see a difference between the father and the mother in the reaction. And this isn't always the case, but it's very common for fathers to be in denial about the ADHD and think that, if we just are a little tougher on him, he'll get over it, or, we just haven't been strict enough. So I think denial is a big reaction.
I think sometimes as part of that denial, then anger follows. I know sometimes I'll see, and as you said, oftentimes, not to point fingers at fathers, but it's most common. I mean, fathers would prefer to believe that it's a function of parenting, especially with ADHD. If you can make a child behave, that impulsive behavior that a child with ADHD has can be controlled by better parenting, then it's much easier to envision that it's the mother's fault. The mother's too indulgent. The mother's not holding the line. She's not consistent enough. And the reality is what parent really is. So I'm sure there's always some truth to it. And at some point, if a child does have ADHD or autism, a lot of times that mother has already tried 17,000 different things and struck out, and probably does start doing some parenting techniques which aren't in the playbook because they're running out of tools.
Yeah.
So I think part of that really is that there's a little bit of anger sometimes that comes along with the father that you see in them. I think also it's a bit of a shock for some people. I know sometimes I'll have a parent will deliver the news, so to speak, and they run. I mean, you tell them your child has ADHD, they have autism, something like that, and it's not a pleasant thing to hear. And so that's when you go through that period of you said, I call it mourning. You mourn the loss of what you thought was going to be. And that can happen for different people at different times. I know for one parent it may happen soon. Another one it may take a lot longer. And oftentimes I don't even know they're experiencing it. So sometimes there's a division that happens between the parents. So I know that's a common problem, and that oftentimes defeats some of our efforts when we're trying to address the concerns parents have as far as learning new parenting tools. So how is it that you get two parents who see things very differently? How is it that you work with a family like that one says it's not there and one says it is there? What do you do?
Well, you provide information, as much information as you can, and you explain what you just explained to me, or the fact that it's very difficult to hear a diagnosis like this, and it's very common to go through the stages of grief, like somebody would go through if they actually lost a loved one. The denial and the anger and the bargaining, those are the stages of grief that parents often will go through when they receive a diagnosis. So giving them information about that too, normalizing their response to it. and helping the parents with their communication with one
So when you
another
say
too.
normalizing the response, that means that telling them that what they're experiencing is normal.
Normal.
It's okay to feel resentful or to feel confused or angry or things like that.
Yeah.
Okay. Because it's a tough go, and I know it's something that takes a while for people to adapt to. I know also children with special needs will affect the family when it comes to doing things as a family. So let's all go to church. Okay, you have a child with autism and you go to church, and he, during prayer time, decides he wants to start making noises. During a quiet time, he yells out something. He doesn't greet people on the way into the church. So that then creates embarrassment for the family. The family feels bad, they feel ashamed. It affects the siblings. The siblings say, oh my gosh, I got a brother or sister who makes me look bad. And as a family, then it becomes sometimes a difficult choice. Do we still go to church in spite of it being an unpleasant experience? And how then do you prevent a family from, if they go through experiences like that, sometimes the world can get pretty small. And that's what I know you've mentioned before, something about being isolated. So how do you work with a family to try to say, watch out, isolation is going to happen unless you don't do something? How do you change that course for them? How do you help them do that?
Well, I would encourage them to push against that and to seek out support and be around other families who are having similar experiences so that they know that they're not alone. But there are ways to, like we had talked about previously, make plans ahead of time to deal with situations. So coming up with a plan to minimize, a lot of attention being drawn to a child sitting in the back of church, in the last pew, so that if something really starts to happen, if you need to take that child out in the back, outside for a little while, just having some strategies for coping with embarrassing situations. But I would always encourage families to try to push against that that natural feeling of sort of hiding from those kinds of experiences.
So then you try to encourage them in spite of some of the behaviors. Did that just to kind of develop a thick skin?
A little bit, but also explaining to other people around them, or explaining to the people in your church, educating family and friends about your child's disability can also help with a situation like that, so that people are more understanding.
I know for us and for many of the people I've worked with, sometimes it's also trying to develop places that are safe places. I mean, starting, as you said, if you work with say it's church or it's a school or it's another activity, and you can educate the people that are there about your child and their behaviors, and that they're trusted people, then you can go back to that place and they start to see it and recognize it, and you don't have to avoid that. So developing safe places, I know for us, were really valuable. And some of our best friends even now are people who help provide that kind of a safe place. And it wasn't just the place, it was the people that we were with. That if we went to their house for dinner, and if our son had behaviors which were not typical or that could be embarrassing, if they could look at it and us and not feel the scorn, because I know that the scorn was very painful at times as a parent. I know a lot of parents now experience that. When they go out into public, they get the look, the famous look, oh my God, why don't you take care of your child? Why do you let your child do that? That you must be a bad parent who doesn't care or isn't trying or something like that. And to get that kind of a look, and then you sheepishly relieve that area, or you get angry. You get angry at the person for not understanding. And I don't think a lot of people still understand what ADHD is or autism is, and that it really exists, and it really is not under the control of the parent, and that the parent may be responding the best way they can. So I think part of that is trying to develop a safe place, a refuge for people. So encouraging them to go out in spite of that. And as you said, I think it's good to educate them and say, okay, where do you go from here? How do you develop those kind of safe places? Parents also need to find ways to enjoy doing things with their special needs child. Do you ever give them ideas or hints or ways of how do you go about finding what is something as a family you can do? How do you do that?
Well, finding things that the child is interested in is a good place to start, because if the special needs child is really engaged and interested in whatever activity the family is doing, then the experience is more likely to be a positive one.
So if the child's content, then the rest of the family's going to be content.
So yeah, that I would say that would probably be the most important thing, is to try to
I know for
arrange it
myself
that
as a
way.
father, sometimes changing my expectation of what might be was not always easy, that I would have to look ahead to some kind of an activity, and then I'd have to see it through autism's eyes, and I'd have to look at it and say, okay, this is what I would like to see happen, but if I take my son with me who sees things differently, how can I blend the two together? How can I still achieve what I want to do and still be a positive experience because he's enjoying something he does? So sometimes it was a blending of the two things. For us, climbing mountains and going out on the hiking and climbing was a great experience for me because we were able to bond doing something I enjoyed doing, but I had to do it a little bit differently. I'm very goal-oriented. He's not.
Yeah.
He likes to explore, wander, do things like that take time, and they take a different path. Definitely not the most direct path. And so as a parent, I'd say, okay, let's see. Can I still get to the top of the mountain to take the windy route up there? So it is sometimes trying to create a new way of looking at that. I know also that as a family and working with families, giving parents permission to say, take a vacation, take care of yourself, go somewhere without your child, special needs child, because you need it. I know that parents of special needs children have a much higher risk of divorce. They have a much higher risk of marital discord and marital dissatisfaction. How do you work with parents knowing that this is going to be one of the things they struggle with? How do you anticipate that for them?
Well, when you brought that up, I thought of an example of a family that I know who the parents, after they received the diagnosis, went in completely opposite directions with it. One completely shut down and went into denial, didn't want to deal at all. The other parent got extremely active in seeking out other families and agencies, and even started advocating for special needs rights, and so
Jumped right in.
right, and so respecting each other's reactions, I think, is important.
Which means
not,
both parents' reactions might be appropriate.
Right, exactly.
Or
There
normal.
is no right way. There's a right way for each person. And so for the parents the husband and wife to be respectful of each other's way of coping is important. But then to also find a way to come together. And it's important for them to nurture the marriage and not lose the focus of their relationship, and have all of the focus be on the special needs child and this new challenge ahead of them. So I do, when I work with parents, I'll assign homework of carving out date night, maybe not every week, but once a month. Or if you can't get out and you can't find somebody to help care for the child, then after they're in bed, make a special effort to sit on the porch and have time together. But just something a time that is dedicated to working on the marriage and keeping the marriage strong.
So that example that you gave where one parent, and I see that commonly, you'll see one parent jump in and it's to some extent in a panic mode, and that's, my child's been diagnosed with XYZ, and there's a fear that if I don't do everything I can, that I'll look back and blame myself for not being a good parent. The fear is that if I don't jump in and do everything right now, that I will miss an opportunity to make things better for my child. So I guess part of the challenge in what you're saying is, okay, I want you and your husband to do something that's restoring for your marriage. How difficult is that to convince the parent who's in panic mode trying to rescue their child to see that? How do you help them? How do you help that person cross that bridge?
It is difficult, and the example that I gave ended in divorce. So, but counseling is a really effective way to help a couple in that situation, because it creates a safe environment for communication and for a couple to hear each other's perspectives and to come up with compromises and ways to meet in the middle. I think really hearing somebody else's point of view is important, and sometimes it's hard to do that unless you're in a situation like a counseling environment where you're forced to sit there and the time is dedicated to doing that, and
you have somebody to
and facilitating
keep you engaged
it.
in this, right? Because I can picture, like in most marriages, oftentimes things have stacked up over time, and it's not something that happened overnight, that there must be resentment between the parents then, because if you have a couple who are doing things very differently, then at least one of the parents is going to feel resentful towards the other because their needs have been abandoned, right? You're talking about one that withdraws and one that's busy working with a special need child, then the one that's, obviously the marriage has got to be suffering. There's no energy going into maintaining the marriage. So there's got to be resentment on one of the person's part.
Or both. I mean,
both.
in that situation, both people are abandoning the other.
True. So you're
by
saying
withdrawing, one's withdrawing, and one's running the other way.
Running the other direction. And both in ways which can be explained then. So the other thing I notice oftentimes is that, and we had to discover for ourselves, is that giving permission to take a trip without the special needs child. The first question that comes whenever I mention that we've done that is, did you feel guilty? Yeah. The initial feeling was, even to consider it, felt guilty, because you think, that would demonstrate that you don't love your child. And to the contrary, I think oftentimes the love is stronger and more intense in ways towards a child with special needs. Yet to let it take all of the joy out of your family or out of your life by sacrificing too much, then it creates bitterness and resentment somewhere in the family, including the other kids. And I know that when you have a family travel or do something as a family without the child with special needs, that oftentimes the dynamic changes, and they see a whole new way of relating that isn't necessarily going to be dominated by or affected so greatly by the child with special needs. So part of what I find to be really helpful is just giving parents permission to do that. If I bring it up and say it, and that it's okay, sometimes I get a little bit of the, you're kidding, right? Is it really okay to do that? So I think giving them permission is helpful. I also know that part of being isolated is not being able to get the help you need. How do you encourage parents to find help?
Well, the parents that I talk to have come in for help, so that's good. That makes it a little bit easier. But we are also really well connected to other services in the community, so we have a lot of opportunities for them. But I encourage them to do it for the same reason that you were just speaking about with the vacationing without the special needs child, because it helps to rejuvenate them. It helps to build them up. It helps to strengthen them, which can then, help them be a better parent to their special needs child. So when I get resistance from a parent who about reaching out and getting their own needs met,
Right.
That's what I always come back to. Well, if you can't do it for yourself, then think of it in terms of this. You're doing it to better, to better yourself for your child.
Why do you think they usually resist getting that kind of help?
A lot of parents are so overwhelmed with appointments and work and their other children's activities, or their special needs child's activities, and or therapies and different things, that I get that a lot of times as a reason is
They're just
time.
too tired?
Yeah, and it's just one more thing to squeeze in.
I know part of what I see also is that there's a reluctance to ask for help. That, to put a burden on somebody else can be difficult. And I know that that's something, again, you have to really push sometimes to get a parent to say, it's okay. Do you have a good friend who can take care of your child? Well, yeah, but I hate to ask them because that places a burden on them. Or there's a fear that something bad's going to happen to their child. So what if I let go even for a brief period of time and something bad happens? How would I feel about myself? And there, the reality is there's always a risk.
Right.
The risk of the child being at school, the risk of the child being anywhere, there's going to be a risk. So I think a lot of times trying to anticipate that there's going to be a lot of fear or a lot of guilt, shame, that I shouldn't have to ask for help. I think
Should
that
be able
comes
to do
back
it
to
myself.
I should be able to handle it myself. So you have these parents who are real troopers, and they're trying to get through it, and they're in panic mode but running a marathon. And I think, again, that's oftentimes it's to stop and recognize that the other parent might have needs that aren't being met. To even stop and take a look at that can be hard to even open that door, because you open that door, you might see it. You might see, I am neglecting my husband or my wife by virtue of doing this. The parent has abandoned the family by withdrawing, that can also be the same kind of a thing. When is that opportunity for me to say, okay, I need to work harder to meet my wife's needs and that sort of thing, and asking permission for that. So I think one of the biggest challenges really is just first starting and saying, okay, we've got a need, how do I meet the need? Secondly, it's being able to have the gumption or the strength or the courage to ask for that kind of help that you're going to get without fearing the repercussions of saying, well, I put a burden on them, they're never going to want to be my friend anymore, or I shouldn't have to do that. So coming back to having challenging kids, challenging families, I think it's really important for us to recognize that it does affect the whole family, the marriage, the family's ability to recreate, to go out and do things that are fun, that they have to change and model what they do more effectively to adjust to what the child has, and then being able to make those adjustments. So, but first and foremost, I think, is recognizing that those issues are there. So thank you for helping us understand this. So once again, thank you for joining us with the Mind series.